Hello, my name is Pierre Mirles for Hewlett-Packard Enterprise. I'm here with Wilfried Grommen. Welcome.
Hello, Pierre.
And Wilfried is our Chief Technologist for Public Sector, Healthcare and Pharma in EMEA. And the topic of this conversation is healthcare. So let me ask you, what are the key trends you see in healthcare in Europe?
I mean, as you know, in Europe, healthcare is closely linked to the public policy agenda of states. I mean, most of the health sector is just funded by the state. So it's very important, I think, from a public agenda perspective. And you also see that in the big development of the European Union and so on, the health agenda is a very big and top agenda.
We're all getting older, huh? So I guess
we're getting older. It's a very good point you are making, because that's one of the big crises we have in Europe, in a certain way, how the social security system can keep up and going. And so that's why your question is correct, that there's in fact a dual tension. I think there's a new way that people want to look at how you can optimize, in fact, the health sector, that we can remain within, say, the social security envelopes which are there, which is the financial constraints, and how can you, in fact, do the cost cutting. And on the other hand, I think it's also a sector where you really feel that the insight and the digital transformation opportunity is so huge, because it's still a sector where I believe in the day-to-day operations, the digital is the new default, has not yet, I think, been fully adopted and exploited.
My view is that we all want to get better, we want to be treated, and the fact is that in some European countries, you know, there's a surcharge, there's a difficulty to handle sometimes in emergency rooms within a short time all the patients that come in. There is great technology, there are great intents, there's life science organizations coming with great drugs to treat patients, but in the end what really matters is the well-being of the patient, getting him to health faster, and I think everybody worries about the health well-being of the patient. And somehow we find it difficult to get to that execution. So I think we need to get back to the core of, you know, the key processes that a hospital has to go through, and how technology can actually help without expanding the budget to the moon, but, you know, help technology enabling the better healthcare attention to that patient. Working with the hospitals.
Maybe just to underpin what you're correctly saying, so patient centricity is core, and we are working with the Karolinska Hospital in Stockholm, where they have in fact appointed, I like the idea, they have appointed patient care officers. So they're analyzing, you know, what are in fact I think they made up a summary around 200 or 250 kind of patient care processes. And so the whole concept now is that if take such a process, how can you optimize this? How can you do that better? And how is then IT a kind of enabler to optimize this caretaking process? And using the buzzword big data, what you can do is you can take a lot of administrative points about people entering you know, the operation room or people leaving the hospital, and you take all this data, and then you can see where people are losing time, or where people are not so efficient, or where in fact treatment could be better, and people you know, are changing too much from department, and this kind of approach is now also taking in the medical world. Yeah.
Right, so big data, importance of big data, but that big data resides somewhere, and more increasingly that's on the cloud, right? And then there are a number of parties that come in onto the cloud, providing services, new services, leveraging some of the big data that exists, all that for the benefit of the patient.
Yeah, and certainly have also the kind of pillarized approach which you have in hospitals, which is very, very deeply embedded in the culture also, to break that, and that people are in fact sharing some of the data, which allows you then to optimize the caretaking process. I think it's very fundamental.
Right. And there we got great examples, great success stories of us partnering with hospitals and helping improve the well-being of the patient while keeping the hospital within a budget envelope that is somehow reasonable. Let's touch another aspect, which is a very interesting one, because that's like in no other organization, that's the workplace. Because the the patient is in a place where he's not really working, but sometimes he wants to access technology, and maybe through wireless. The doctor is moving from place to place, so the workplace is not a physical place; it's becoming a virtual one. Tell us a little bit about that.
But there, I think you're right. I think that if you see what digital can really bring to the care delivery process, is I think threefold. First of all, it is true that people will have the information at hand with the interaction devices, with the tablets and everything you're going to have there. Then of course you need the applications. There's a new, people sometimes say is a second generation, I think is even the third generation of electronic patient record systems, which give you then in fact the complete information of a patient at the bedside on this kind of computing device which the doctor or the nurse has in hand.
So that workplace travels with you as you're a doctor. You move from patient to patient and then potentially home, and you're still in that workplace environment, sometimes not even on the same device, but that virtual workplace travels with you.
So absolutely true, but then immediately you raise the issue that can you have access to all that information everywhere? And then you come to a point that the access aspect, because Wi-Fi is in fact breaking through, everywhere, and certainly also in hospitals. We call that the kind of wave of the intelligent building wave, that people are providing, I think, a whole connected infrastructure as part of the buildings of new hospitals, of greenfield hospitals. But then as an example, what we as a technology try to promote is the concept that it is of course that a doctor can have access to that information when he is there, but he has not access to that information, or anyone cannot have access to that information. And so you need...
So it's contextual access to information.
Extremely important.
Managing the security of that access to the information based on who you are, where you are.
Absolutely.
And what you do.
And that is then part even from, say, from your networking solution together with a concept what people call localization-based services, so that it is based on where you are entitled to do things.
Right.
Or based where you are guided by an app, as an example, how to find your way or how to look for the right, say it, instruments when you are in the, that is very important.
That is so helpful. I was in a hospital the other day and trying to find a patient that was in the hospital. It was a huge place, and to find my way took me 20 minutes to eventually get to that room, and it would have been great to have an application that gave me direction and turn left, turn right, and get to that room. So that is something
that is today out of the say the networking gear that we as a company, as an example, provide. This
with
is really,
Aruba,
which is really possible to do,
right.
And also with beacons, which allow you to in fact pinpoint people what to do and what they get as information on their mobile devices. It's really steered, yeah.
So we got great examples of how we engage with hospitals, taking them to the 21st century, helping them control their costs while improving patient healthcare, embedding that in the ecosystem of the folks that they have to deal with, whether they're doctors, insurance companies, families that come and visit the patient, and from taking charge of the patient all the way to discharge. The next step for a hospital or a healthcare organization that would be interested to explore the art of the possible would be what, a workshop? How does that happen? You mentioned Karolinska hospitals. Is that the process we went through with them?
In our position, of course, we are well placed that we see the best practices in the world, where the best hospitals are doing very creative things. And I think we could definitely, when we work with some of these hospitals, create kind of a workshop where we do share best practices, and that they tell us, like we were doing at Karolinska, where we have done kind of an innovation partnership, is let's analyze your process, and from our perspective, what we've seen elsewhere, or what we know technology would enable you to do, maybe you can get then really cross-fertilization between, say, IT and then the medical sector, and come to better caretaking.
Right, and in a partnership, really.
In a real partnership, that's what it is.
Yeah,
that's really what it is.
Right, okay. Wilfried, thank you so much.
It was a pleasure.